We shall start with an opening prayer. We shall have welcoming remarks. We shall have the introduction of panelists. We shall have the presentations by the panelists. Kindly let us thank you. So I was saying, after the introduction of the panelists, we shall go to the presentations by the panelists. Then we shall have the questions and comment session. Then we shall have closing remarks by the panelists. Then we shall have a vote of thanks. That is our agenda for today. So when we reach the presentation, this will be the order. We shall start with vaccination. We go to mental health, and then homeschool. So at this very time, allow me, let me introduce myself. I'm very sorry. My name is Monica Nalum. I am a young leader. I'm going to be the co-moderator of this session. So let me welcome Patience Mark to please take us.
Good afternoon, everyone. You are very welcome for this meeting. I'm Patience Makai, and I happen to be the COVID-19 response team head on the YES team Uganda for this year. Yeah, and we organize this event to help each other survive through this time. We know that times are difficult and things may get overwhelming. So just to uplift each other, this is what we are going to do. Yes, so let's start with an opening prayer from someone to volunteer and give us an opening prayer. No. Okay, let's pray. Dear Heavenly Father, we thank you for this day. Thank you for gathering us here today. We pray that you bless our panelists and give them the right words to say to us. Be with us through this all. In Jesus' name we've prayed. Amen.
Amen.
Yes, so first we'll have welcoming remarks from our coordinator. We usually call her Mama Yes. Yeah, and I'm honored to invite Madam Kathy to come and say a few words about this event, why we're here, what Yes is, probably for those who don't know. Yes, before we continue to the next part of the agenda.
Thank you so much, Patience. Thank you for organizing this event. And we know it is not easy, but thank you for the work that you've been doing. You recognize the presence of Dr. Daniel Tumwine. Also recognize the presence of Mr. Godfrey Chaze, our panelist. Also recognize Sarah Namtebi. Sarah Namtebi is going to talk about mental health. Recognize the presence of the Chief Commissioner, Molly Grace Akelo. You're welcome. Recognize the presence of our International Commissioner, Prosi Imela. I've also seen some board members around. Persis Namkasa, you're welcome to this discussion. I thank you all for being able to attend this discussion. I know that times are not easy, but at least you've spared your time to attend. And I would also like to welcome those who are still coming on. The people have not yet joined, but I see them joining. Thank you so much. And in short, this session was organized by the Yes Girls Movement. Yes Girls Movement is a project within Uganda Girl Guides Association. This project is an exchange program between 13 countries, 2 of which are in Asia Pacific, that is Bangladesh and Nepal, then others are from Africa. So this exchange program, the girls leave Uganda, the girls leave, go to another country, stay there for 6 months, then after 6 months they return and share their learnings, what they've learned from there. Then and also those ones who go, they also share what we do in Uganda. It is basically, we are supposed to learn about guiding and then also the cultural exchange. They're supposed to learn something from there so that when they come back, they do something. So this year, we couldn't have an exchange program because of Corona pandemic. So this year, we decided to have a non-travel exchange, whereby the girls within the country remain where they are, but we still do activities within our country. So basically, one of the teams, this year, we have 5 teams, and one of the teams is on COVID response. So there is a team of 5 people who are working on COVID response. And this is one of the activities which was organized by the COVID response team. So members, I'm happy that you're all here. And I hand over to Monica and Patience. Please take over.
Yeah, thank you, Madam Kathy, for those words. Let's we'll go on to introducing our panelists. I request that when your name is said, if you could maybe wave at us. Yes, so first we'll have Dr. Daniel.
Patience, please leave them to introduce themselves. Let them introduce themselves.
All right.
There's a lot we don't know about them.
Okay. So let's invite Dr. Daniel Tumwine to say something about himself.
Thank you very much, everyone. Sorry, I'm at home somewhere, so if you hear some people are screaming in the background, please, my apologies. I should put this a bit here. My name is Daniel Tumwine. I'm a pediatrician. I've done a lot of work in vaccines, the vaccine space, vaccinology. I'm currently the Africa champion for what we call the International Pediatric Association. And I run clinics, children's clinics. One of them is Children's Clinic Nalia. Many people might have heard about it. I'm a teacher by training. I love teaching. My parents are teachers. My grandparents are teachers. So I love talking to children and also adults. And I pray that what we discussed today will be very, very simple. And thank you again for inviting me. I'll apologize and say I might have to remove the video because my internet stream, what I've learned is that it can't take too much. So I'll have to present when my video is off. So I want to thank you guys for inviting me. And my problem, as I told Kathy earlier, my presentation might be slightly long, but I'll try as much as possible in the time that has been allocated. So thank you very much.
Okay, thank you, Dr. Daniel. Next, we'll have Godfrey Chazi to introduce himself and say a little bit more.
Thank you. Yeah, my name is Godfrey Chazi. Married to Olga. We have 4 children. If you can see, this is my family. I'm showing them on purpose because part of my sharing is about them. We homeschool them. The 4 children are between the ages of 3 and 12. Homeschooling is part of what I'm part of. I'm a teacher, I'm an educator. I'm involved into training teachers in schools across the country, but also do some programs with some universities. And as well, I coordinate a program that brings together families that homeschool their children. This is something we've been a part of even before the pandemic. Briefly, that's what I can say for now. Thank you.
Okay. Thank you, Mr. Godfrey Chaze, for accepting to be on this panel. Yes, next we have our last presenter for the day, who is Namutemi Sarah. Yeah, she happens to be a girl guide too.
Yes,
Patience,
although
we
I
don't
have
hear you. Okay,
not-
it's okay.
Can you hear me now?
We can hear you.
Wonderful. Okay. Good afternoon, everyone. As you've all heard, my name is Sarah Namitevi. I'm a social worker by profession, but I'm mostly practiced within informal education. So I've been doing social work for the past 21 years, working with young people in particular, but I also work with families and individuals, and especially to do with mental health as well, and young parents and so on. Mainly my experience of social work has been in the UK, in the United Kingdom. So excuse me if I don't have all of the information on mental health in Uganda, but I'm very happy to be here with you all, and I'm very excited to learn more on the vaccinations and whatnot. So thank you all for joining, and you'll hear from me later on.
Okay, thank you. Yes, so for those who have just joined us, and those who do not know why we're here exactly, our theme for today is surviving through the lockdown. And yeah, we'll get right to it. Yes, let's have our panelists, starting with Dr. Daniel, who will take us through vaccines. Yes, he has a presentation for us, and then after the presentation, we'll have some questions. Maybe questions for him or something we haven't understood, something we'd like to know. All of that comes after the three panelists have presented. Yes, so over to you, Dr. Daniel.
Thanks a lot, Patience. I assume I'm going to share the screen. I don't know if I'm able to share it. You might have, the host might have to disable, has disabled participant screen sharing. So is it possible for whoever is hosting me to kindly enable it so that I can share? Okay, thank you. Give me a second. Okay. If someone can see me or can see my screen, do let me know.
It's sharing, no worries.
Sorry?
Starting to share.
Okay, I'm failing to take this. There's a way it has, hold on, there's a way it has, oh my goodness. Hello? Okay. Everybody can see? For whatever reason, my screen seems to be slow. Are we good? Can someone, one or two people just say we're okay and then we'll start? Okay, guys?
Okay.
All right, okay.
We are okay. We are here. We can hear you.
Okay, because my computer had stalled, had frozen. But So I just want to thank you again for the time that you guys have given me. I'll try and be as much as possible, as quick as possible, but also as thorough as possible. Thank you again for the opportunity that you guys have given me to talk about vaccination. I had actually edited this conversation. This conversation I usually give is, I usually have two different talks. One is a long talk on vaccination, and the other one is really a long talk on how to survive COVID. So I edited both and made one small slide, and I hope that it will be very useful to all of you. The objective of my presentation, we'll probably miss out on the objectives. I want us to we'll probably discuss the Ugandan situation on COVID, and then understand what really COVID-19 is. We'll then talk about progression of COVID-19 disease. Then we'll then have a deep dive on vaccination. We'll say something small about hesitancy, because that's very important. We have a lot of what we call anti-vaxxers, and we'll discuss what the difference is between a person who is hesitant and one who is an anti-vaxxer. Then we'll discuss vaccines in general. I'll just give a few illustrations. Then we'll come down to the types of coronavirus vaccines. We'll talk about those. We'll discuss the safety. We'll discuss the effectiveness, or what we call the efficacy of these vaccines. And then eventually we will talk about emerging issues in vaccines. There's a lot of questions that have been out there that many people have about vaccines. And so under emerging issues, we'll probably just touch on a few of them, and hopefully we'll be done in time. So just to understand where we are in Uganda, currently, as you can see, we are on a lockdown, which was imposed around 7th or 8th of June. I can't recall exactly which date, but because of that, our daily infections have actually gone down. As you can see on this graph, Uganda has had two different waves, or 2 or 3 different waves, but generally, the current one that we had was by far the largest, where at one point we had 1,500 people being infected at once. Right now we are down to below 500. I think the latest data is 420, as we shall see in the next slides. You will also find that the lockdown has also helped decrease the number of deaths. I think our highest number of deaths, reached somewhere around 60. Even there are a few which had, there was a day, where we had quite a large number, 84. But now our deaths have gone down. A week ago, they went back up again, as you can see from this particular view, but they have now gone back down again as well. So generally the situation in Uganda is that we are on a downward trend. Right now, we are around 30% or 20, accurately 27% of our peak, and we are having a downward trend, which is a very good thing. As you can see from this observer tweet, in Nambole, for example, at one point it was very full. Now it is around very low capacity, and the Nambole treatment center really treats patients who are sick enough to not be at home, but not sick enough to be in hospital. And so right now we are having very few patients in Nambole, and also in Mulago Hospital, where there have been a large drop of patients. I think what I know from Mulago is that there might be around 11 patients in ICU, compared to the peak where they had more than 40 or 50, and they were chasing patients away because they just didn't have enough beds. So right now, at least if someone needs hospitalization and ICU, there is always space in almost all the hospitals in Uganda. This is today, or this is what was tweeted yesterday by the Ministry of Health, and so this is the latest information as accurate of 18th July, and as you can see, we have 254 new cases. The last few days we've had roughly 400. new cases per day. Right now, I think this is the lowest number of new cases we've had in a while. So that was yesterday. And the deaths have been hovering between 30 and 40. Yesterday, they went down to 20. Our test positivity rate, as you can see down here, is 8%. At one point, we have what means that of all the people who go for testing, 8% are positive. What that means, 92% are negative. So that's great, because at one point our test positivity rate was at 25%. Now it is down to 8%. A good time to open, or at least a good rate that public health specialists always say good, is the test positivity rate of 5% and less. So here we can see we are from 25%, we are now at 8%. We're not yet down to 5%, but we're getting there. You can also see the number of administered vaccines. We'll talk about that at the end. We are hovering really around just above 1 million, 1.1. The rate of increase of vaccines hasn't been going up that much. The main reason really is that while we have, unlike other countries, while we have vaccines in country, the vast majority of people are not able to access them. Number one, either because they've said that they're...
Sorry to interrupt you, Doctor.
Yeah,
I'm sorry to interrupt you, but we can't see your screen.
Is there anyone else who can't see my screen?
The screen was not able to share. To come.
There's no screen at all? Screen is paused. Someone, I don't know why it says your screen sharing is paused. Did I? Okay, let me try again.
It's on now.
Yes, it's
Okay.
on.
Yes, it
Thank
is.
you. Okay, so I don't know where it had gone, but so I was discussing and saying that I don't know where we have 254 new cases. We have 20 new deaths, and our positivity rate has gone down from 25% to 8%. So that's a good thing. And our total vaccination is 1.1 million, which is actually a good thing. It's higher than many countries in Africa. We have the vaccines in country, and we'll discuss a few of them. But the issue is that right now, the people can't access them who need them, because many of the vaccines have been in central business districts, particularly in Kampala. Those who are up country have been complaining that there's been no vaccine. And most of the vaccines, as I said, has been in Kampala. Yet many people are under lockdown and can't move to central business. For example, in Kololo, in the women's hospital in Mulago, there are large vaccination centers who are not getting people. But if you stay out in the outskirts, such as Nalia and other places, there are very few vaccination centers, and the vaccines run out immediately. So my understanding is that since last week, the Ministry of Health has been working to make sure that some of those vaccines that are in Kampala district go to the periphery, such as in Wakiso, in Mukono, and other places as well. So, but we are kind of slow in terms of vaccinating. This is really the age distribution of the persons with COVID. As you can see, the vast majority of them are between 20 and 40 years in terms of infection, but the death rates tend to be higher in the elderly, as everybody knows. But specifically for this Delta variant, and we shall discuss about the variants in a few slides, the death rate still shows, what it still shows is higher in elderly. We are seeing a lot of deaths and also severe disease in the young, and most of them, almost all of them, are unvaccinated. And this slide is really just about to explain the Ugandan situation in terms of vaccines or in relation to the rest of the world. If you look at Africa here, a month ago, all these countries, these are countries, all these countries were near Africa, were near zero. All the countries have moved forward, or all the continents have moved forward, except Africa. Here, we are stuck between 0% of vaccination to 10%. Many other countries have moved to 60%. Like in Europe, for example, a week ago, 3 weeks ago, most of the countries at 60% were at 20%. So countries are moving, they are moving right, as you can see, but Africa, we are still doing badly in terms of vaccinating. And Uganda, as I can see this angle here, this arrow, shows that we are doing better than many countries in Africa. We have 2.4% of our people who have had any form of vaccine. Some countries have less than 1% of that. Now, of course, as I mentioned, currently we are under lockdown, and the main reason really is about the wave. But the problem is that even if they opened up, there is nothing that is going to stop us from having another wave and another wave and another wave. And the important thing is that the waves will stop when we have a large number of people who become vaccinated. So that's just like a preamble. So vaccination is very, very important. So that's just sort of like a preamble. Now, what I really want to discuss before we discuss vaccines is really what COVID is, and then we'll connect it into the vaccine. Number one, what we all know is that COVID is a rapid, at least coronavirus, which causes COVID, is a very rapidly evolving virus. If you recall, at the beginning of last year, we had the Wuhan virus, or at least the Wuhan variant, what we call the Wuhan variant. Because it came from Wuhan at that time. And then we had different types of variants that came up. The reason is that as viruses multiply, you end up with mutations because they don't multiply very easily. Or they don't multiply very well. They are very inefficient in replicating themselves. So viruses, if you recall, your O-level or primary school biology, they are in the middle of living and non-living things. And therefore, for viruses to multiply, they need to enter a cell. A virus which is on the table will easily die off because it cannot replicate. For it to replicate, it must enter a cell, go to your DNA, go to your nucleus, enter your DNA, and hijack that cell's DNA to produce more viruses. And then after that, the cell bursts and releases different viruses. So as it does that, it is very easy to have mistakes in the coding, and therefore it mutates. The mutations can either be positive mutations, meaning that they can be less effective, or the virus becomes transmission or less effective in causing severe disease. Or it can be, the mutation can be very bad, where its transmissibility increases, or the virus causes more severe disease. And as the Wuhan virus was multiplying in different countries, the mutations evolved, and the key mutations that we know of are the ones of Kent in the UK, South African, the ones in California, the one in India. Of course, now, starting March, the WHO and CDC decided to stop naming the viruses according to the countries of origin, so that we don't have stigma against these countries. So now we identify them as according to the Greek alphabet. So for example, there's the alpha variant, there's the beta variant, there's the delta variant, and there's the theta, omega, and stuff like that. So right now in Uganda, as we shall see, we have mostly the one from India. And the one from India is what we are calling now the delta variant. Just give me a second. As you can see from the next slide, you will see that the delta variant is 2.5 times more transmissible than the original SARS-CoV-2, the one which was found in Wuhan, and it's 60% more transmissible than the alpha variant, the one from the UK, etc. So the one that we have and the one that is attacking the world right now is extremely transmittable. It may not necessarily be more deadly, but because more people get the virus, because it's easily transmittable, more people tend to get severe disease than would have been the case, and therefore more people tend to die. But what we are seeing in Uganda is that we are getting younger and younger persons getting severe illness in Uganda from the Delta variant, and also more and more children are also being affected compared to the previous one that we had in Uganda, and I will talk about it in the next slide, I think. Now this slide is probably my most complicated slide, so I hope that you stay with me. This just shows you the type of viruses that we had throughout since Uganda got coronavirus. If you look at the first table A, you can see the orange that is in, so you can see we had what we call the B1, which was dominating, that's the orange one. Then that was between March and May 2020. Then between June and August 2020, we had both the B1393 and the A23 dominating. Then around September, when we started having our first wave from September to December, or October to December, we had the A23 as the biggest variant. Then at the beginning of the year, we had A23.1 as the one that is the next variant that started dominating. Now, if you look at this slide, it looks complicated, but I can assure you it is not. Can somebody with Techno F1 kindly be removed or stop being on the screen? Hello? Hello?
Yes, please, let's work on it.
Yeah, sorry. I'm in the waiting room. So if you can see this slide is, it looks complicated, but actually it's very simple. If you look at this lineage column here, you see B1617, B1617, blah, blah, blah. And when you see this B1617, that is the Indian or the Delta variant, and you can actually see that all of them are the Delta variant, except only one. And this was released at the end of June to show you that almost 90% of the coronavirus that we have in Uganda is of the Delta variant. And that's very important. In the US, it is also spreading, as you can see. And also and just, yeah, as you can see, guys, can I quickly just do a new share? Just to remove this. So, as you can see, the purple here, the Indian variant is going up in the United States, and very soon you're going to see that they might end up needing a lockdown, or at least in different places where they have low vaccination rates. So you can see here, the Indian variant is rising, and the same here, 20% by June, a month ago, 20%. of all new infections with the Delta variant. Now I'm told it's around 60%, and most of them are in states where there's very low vaccination rates. So vaccination, as we are beginning to see, is very important. This is in the UK, where you can see this purple one is the rate of rise, of the what? Of the Delta variant. And even on the, and here also, if you look at the yellow, these are other variants in the UK and England at least. And then you can see here, the red is where the Delta variant is coming. So we're beginning to see in the whole world that the Delta variant is spreading, and the best way to beat the Delta variant is get vaccinated. And as we shall see later, one vaccine might not be enough to protect you against the Delta variant, unlike the other variants that we had previously. So our first Delta case came in Uganda around mid-April, and it usually takes 3 or 4 weeks to multiply, to double. So we might have problems if we don't get vaccinated, because, and the important thing is to get vaccinated 2 times. Previously, one shot of vaccine was good enough to protect you against all the other variants except the South African variant. So that is just understanding that it is a what? It is a rapidly evolving virus. The second thing is that COVID is a heterogeneous disease. What that means is that it presents in different forms or in different. Many people. Many of us will be asymptomatic. We can have mild disease, then moderate disease, severe disease, and then we can have critically severe disease. So the presentation is a large spectrum. It's assumed that 40% of people who get coronavirus will never get any disease. So they'll walk around town all asymptomatic. And then a few of them will end up with mild disease, and then another one will get, others will get moderate. So 80% of patients with symptoms will either have mild or moderate disease, coronavirus disease. Then 20% of them, the remaining 20%, will have severe or critically severe. Critically severe is usually between 10% or 4 to 10% of the people who get coronavirus. And this is the previous, under the previous variants. We don't have exact data right now of the Delta variant, of how severe it is. As of today, we don't have that data. As you can see, the severe and critically severe patients are usually the ones that end up in hospital. And one of the reasons why they end up in hospital is usually because of their oxygen levels being very low. In another talk, we can always discuss about what that means. But suffice to say that actually when the patient has COVID, the most important thing that we must always look out for is their oxygen saturation. And I always tell patients and their parents and anyone, and please make sure that as much as possible, you have a pulse oximeter in the home. Right now, they cost anything between 60,000 to 120,000. Everything else is background music. If you're able to monitor your oxygen saturation and you're able to intervene in time, very likely your patient won't end up in hospital. Or if they do, they'll end up really with good interventions early, as we shall see in one of the slides. And once intervention is done early, the survival rate is very high. So oxygen monitoring is very, very key. All these other drugs that have been talked about, and should we take this? All that is just background music. Monitor your oxygen levels and have a plan of what to do when your oxygen saturation goes down. You want to make sure that your oxygen saturation remain above 95%. Many people, their oxygen saturation is around 100, 99, and 98, unless you're pregnant, when it can be lower, around 93. But generally, keep your oxygen saturation rates below 95%. If they go below 95%, make sure that you're calling a health worker or calling a doctor and plan and say, you know what, my oxygen sats in normal room air are less than 95. And then the idea is that you want to start planning, looking for a bed which has oxygen, and so that by the time your oxygen saturation reaches 90, you are now not running around looking for a hospital. Yet actually at 90, you want oxygen. So between 95 and 90, you should be engaging your health worker, your doctor as closely as possible, such that if they ever go below 90, you are now in a position to get oxygen. Unfortunately, in Uganda, many people start running around when they start having very bad symptoms of low saturation. For example, you can't walk, you can't breathe properly, you're tired, you can't finish sentences. At that time, you need oxygen. You don't want to be running around. So I always tell people, get a pulse oximeter, measure your pulse oxygen, so your blood oxygen, 95 and below, start looking for a hospital. That's what you understand it is plan B. So that is just severe disease. And that's just to explain to you that we have a heterogeneous, COVID is a heterogeneous disease. And why is this important? Because it is a severe pneumonia. Now, severe pneumonia is really just an infection of the lungs. So there are many things that can cause a severe pneumonia. For example, one of them is not rain or cold weather. It is actually infections. You have other viruses which cause pneumonias. We have bacteria which cause pneumonias. Coronavirus is a viral infection that causes pneumonia. And as you can see, usually a pneumonia means that there's fluid that builds up both in the tubes that take air to your lungs, what we call the alveoli, where the exchange happens. So there's fluid in the tubes, but there's also fluid where the air sacs are, so you can't exchange oxygen properly. And because of that, your blood oxygen goes very low. This is where the oxygen is taken to the blood and carbon dioxide is removed. So as we said, the alveoli here is filled with fluid. So the oxygen, while it comes from the air, it can't exchange into your blood. And this fluid is caused by what we call a viral response and the body's own reaction, what we call hyperinflammation. And this is very key, both in the way the vaccines work and also the way your disease severity continues. So we'll come back to that after this slide. But I also wanted to show you that COVID is also a clotting disease. We don't talk about this very often, but 16% of people who get COVID are very likely to clot. I know very many people tend to fear the vaccines, that they cause a lot of clotting, but actually they don't. They cause it so rarely that one in 250,000 people are likely to die because of the vaccine, and that is 0.004%. If you look at the risk of taking morning after pills, it is 0.05 to 0.1. That's almost 100 times, or 10 to 100 times more likely than the AstraZeneca vaccine. And of course, if you're a smoker, you are more likely to also get clots. If you get COVID infection, for example, to get a COVID infection, the older you are, the more likely and above, you are 50% likely to get clots when you get coronavirus. If you've ever had clots, for example, if you ever had stroke, if you've ever had a heart attack, which is due to a clot, then your chances of being in ICU is up by 71%. So many people who have had strokes and heart attacks try to avoid the vaccine, yet actually when they get the coronavirus, their chance of getting severe disease is very, very, very high. And so if you don't want to get the vaccine, my advice to you is you go to a desert island where you know you're not going to get coronavirus, because if once you get it and you're not vaccinated, the chance of you getting coronavirus is extremely high, and we don't talk about it very often. So this is what I was now discussing previously. When you get coronavirus, usually you get very mild disease, what we call most likely in phase 1. Here, your body is just fighting the illness, okay? And the effects are not really that bad. And then eventually you start have lung involvement in phase 2. And usually this is mostly because of your body fighting coronavirus. And so you end up what we call a hyperinflammatory stage. And by the time it becomes more and more severe, you need admission. And then you end up needing high dependence unit. And then you end up having clots. And once you have clots or having other organ damage beyond just the lungs, you end up in ICU. So it's very important that many people understand that actually it is very easy to go downhill, basically because of the body's reaction to the infection and also the clotting. And it's very, very important about that. So why am I saying that? Because once this looks very complicated, but I promise you it's very simple. Because once you have mild disease, all you need is a certain inhaler. I won't tell you what, because many patients will then run and go and buy it. The data shows that this particular inhaler is very good at managing mild disease. You might need what we call monoclonal antibodies, but these are very expensive and I don't recommend them because they can cost anything between 6 to 7 million. And then you can also need paracetamol. And that's really all you need, at least in stage 1. Then when you are admitted, there are so many other things that you need that if you don't get them, you end up in intensive care and then you can die. If you look at this dotted line, there's a dotted line that is going through this whole graph. That is the severity of disease. So the more you enter, the more severe you become, the more intense the care is needed. And as you can see, for example, this is something that was going along on a WhatsApp group on social media. This is one of the monoclonal antibodies. I don't know if you can see it. The amount here is 7.5 million. This is in Uganda here. So many people keep saying, healthcare, the doctors are stealing money, but actually the medication and the care that is needed is extremely very costly. So you can see here 7.5 by just having what we call a monoclonal antibodies that is going to be helpful in managing your COVID. Just give me a second. Next, I'm just trying to. Then another thing that we want to discuss is just supportive care. Whether you have very mild COVID or severe COVID, and the cheapest care that we have is just lying on your stomach. And we keep telling people this, you don't need as complicated medication in many areas. Even if you're in ICU, all you need is just to lie on your stomach. And the reason is when you lie on your back, you end up having some of the alveoli collapsing. And then here you end up, when you lie on your stomach, all your alveoli, all your lungs are open, and then you can have good aeration. So this is just lying on your back. It costs absolutely nothing, but it can help massively improve your oxygen rate. And then long COVID, I just want to say something very small before I go to vaccines. Long COVID is so important because right now, as many people are surviving COVID, there are patients who continue having symptoms 3 months later. And many of these people tend to be female. They tend to have had mild disease. And many of them, it's the lungs and the heart which is involved. So you find that they're unable to breathe properly, even if it's 6, 7, 8 months down the road. They have heart conditions as well, but many times they present with fatigue, with anxiety, and with palpitations. So long COVID is something we are not talking about a lot, but very soon, as many more people recover from COVID, a lot of people are going to have a lot of sequelae and side effects of the COVID, and it's important that these patients are actually addressed. And please speak up if you do have long COVID, because right now many more clinics are now starting to see many patients with long COVID, and it's usually 20% of these people. So why am I laboring to say all this? The important thing is, if you remember the the slides I've been showing you, the severity of the disease keeps increasing as the days go on for many people who have vulnerabilities. And this is especially if you don't give any treatment or if they're not vaccinated. But if you just give treatment, you can actually help decrease the disease severity, even whether you're vaccinated or not. But if you are not vaccinated, so if you're vaccinated, you can see this small line. Whether you have treatment or not, you will find that the severity of the disease doesn't become very pronounced. So you end up with mild disease. And this is just something that everyone who has taken, who is into vaccinology and has understood. The vaccines themselves don't prevent you from catching COVID. What they do is that they prevent you from getting severe disease. And once you don't get severe disease, your chance of dying is very low. Now, very many people have said, but you see, I've gone and I got vaccinated, but I got coronavirus. Yes, you can still get coronavirus. Very few people can still get severe disease and die. For example, the vaccines are around 90% effective. That means that there is still 10% of people who will still catch the severe disease. So they're 90% effective against severe disease, or 95, 96% effective against severe disease and death. So there's still a small percentage who will still catch the virus and get severe disease. Now, when you do get the virus, it is important to also know that you can still transmit the virus to other people, but the rate and level of transmission is down by 66% or 2/3. So you're 2/3 less likely to give the vaccine, to give the virus to somebody near you. So somebody who is not vaccinated is 2/3 more likely to continue spreading the virus compared to somebody. So even just by vaccinating, you are reducing the spread, but not to zero. So vaccination is very, very key in preventing transmission as well. So as many people can get vaccinated as possible, the less likely that the virus will be circulating in the community. So that's just something to talk about in terms of disease progression. Let's talk about the vaccines now themselves. Very many people keep telling us that, you see, doctor, these vaccines are made by they're made by these Wazungus, and these Wazungus are out to kill blacks. You know, so for me, I'm not going to take them. But if you look at where the vaccines have been carried out, you find that actually it's amongst the same Wazungus. In fact, if you look at Africa, there's almost 0% vaccination. So why is it that they are making vaccines that are going to kill themselves? So I always tell people that the best way to kill off any person is to put something in their water, because I've never seen somebody who doesn't go without water. Vaccination is the hardest way. These Wazungus are busy going to Mars and also going to space to care too much about an African race that they want to kill off. So members, some of these are rumors and there is no scientific data, and so please do get vaccinated. And for whatever reason, it is us guys who tend to really want to, who have the myths, the minorities, were the ones who need the vaccine the most. We're also the people who have the highest hesitancy rates around. Many Black Americans, many Black and minority groups in Europe and in UK tend to be the ones with the highest types or highest level of vaccine hesitancy. Yet we are also the same people who have diabetes and hypertension and asthma, the exact conditions where if you ever got coronavirus, you are most likely to die. So please make sure that as much as possible, you go and get vaccinated. The vaccines are relatively safe and extremely effective. I just wanted to say something about other vaccines and other pandemics, because this is not the first pandemic that the world has seen. Previously, we had what we call the Black Death. A Black Death has basically killed millions and millions of people, almost 200 million. It is called pestis, spread by fleas. Previously, we used to think it was spread by black rats, but now it is spread by fleas, and those fleas infect the humans, and it can cause death. And it was very deadly. And what happened with that vaccine, with that pandemic, in 1896, it was developed by a Russian. A vaccine was developed by a Russian in 3 months, and it was found to be 50% effective. Why am I saying this? Because some people keep saying, you know what, me, I don't want a Russian vaccine. I only waiting for the American vaccine. I don't want the Indian vaccine. I want the Europe vaccine. Yet the Black Death was developed, it was a Russian vaccine, which was developed in 3 months. People keep saying, you see, for us, these vaccines have only taken less than 1 year. I can't take them. But the one for Black Death was 3 months, and it is 50% effective. The ones that we have are actually 80 to 90% effective against severe disease. Yet this one for the Black Death, what we call the bubonic plague, is only 50% effective. And right now, the only places in the world which have the bubonic plagues are mostly India, Bangladesh, and those Southeast and those East Asian countries. So that is just for bubonic plague. Spanish flu, you've probably heard about it, killed 100 million people in only 2 years because it was airborne. Its subtype was something called H1N1, and the reason why that's important is because we also had an H1N1 subtype of flu in 2009, what we called the swine flu, and the vaccine was developed in 6 months. It was this swine flu was in Canada, in the US, in China, Hong Kong. It never really came to Africa. But they developed a vaccine in 6 months, and then it was the first vaccine to be used under what we call an emergency use authorization. This is very important, and this is the source of many conspiracy theories and very many questions about the current vaccines. Emergency use authorization means that while it might have taken 10 years for the vaccine to develop, we have gotten enough data which shows safety and efficacy or effectiveness, and to make sure that at least the risk of doing nothing is very terrible than doing something about it. We're not going to wait for 10 years of coronavirus circulating in Uganda before we can start vaccinating people. So there's what we call a risk-benefit ratio, and it is only under emergency use authorization that it is done. If there was no emergency, this vaccine, the Ebola vaccine, and the current coronavirus vaccines would not have been used, would not have been approved. They would have needed years and years of study to make sure that actually there is no side effect even 10 years down the road. But because we cannot wait, you end up getting what we call an emergency use authorization. And that is why people keep asking, but why am I signing when I go and vaccinate? It is because you're having it under emergency use authorization. Let me talk about smallpox. Smallpox was a deadly disease that was existing even in the Bible. Even in the Bible, this is smallpox. And in 1977, the last smallpox case was had, and it was this gentleman here. Unfortunately, he died in 2012. But right now, smallpox does not exist. It is the first disease to completely be eradicated from the face of the earth through vaccination. So vaccinations actually do work. Now, smallpox only exists in 2 labs in the US and also in Russia. So and smallpox vaccine had very severe side effects, was not as effective as the vaccines we currently have, but we managed to eliminate it through vaccination. And then lastly, before I go to discuss the different types of coronavirus vaccines, polio, we almost eliminated polio in 2004. 2003, 2004. In fact, it was only Nigeria which only had polio in the whole world. But what happened was later, the imams in Nigeria refused to get vaccinated because they thought it was a plot to kill off Africans. And that is how, for example, Boko Haram came up, because Boko means Western education or Western living, and Haram in Islam means something that is not acceptable. So these imams felt that the polio vaccines were Western things meant to kill them off, so they refused. And then within a few years, the polio spread again to Africa, to like 23 African countries. And not only that, it also spread to India and Pakistan. And as a result, the efforts had to be redoubled. And now the only place which has natural polio is in Pakistan, where Osama bin Laden was killed. And the reason is, when they were trying to see if it was Osama bin Laden, they made the US guys made a false vaccination drive, and then they, instead of vaccinating Osama bin Laden's grandchildren, they took some DNA and found that actually these children belong to Osama bin Laden's grandchildren, and so they confirmed that Osama bin Laden lived in that area. So that whole region ever since has refused vaccination against polio, and it's the only place in the world right now which still has wild polio. Even Africa doesn't have wild polio anymore. So that is just other vaccines, just to show you that vaccines actually work. There's a whole history of vaccination that has improved the healthcare of society. Now, for COVID specifically, for what we call SARS-CoV-2, currently SARS-CoV-2 has led to 4.2 million deaths and rising. But the important thing about COVID-19 is this spike protein here. We'll come back to it in a few minutes, but I just wanted to show you that this is the COVID-19 virus, which has caused all these deaths. But this spike protein is so important because that is where the vaccines target. So this spike protein, maybe if I can tell you, is that it helps the virus enter the cells. So if you target that spike protein, the virus won't be able to enter the cells, and therefore it won't be able to cause severe disease. So all the vaccines that have been developed against COVID target that spike protein. And there's a reason why, because coronaviruses generally all have the spike proteins, and research was carried out years and years ago. And it was found that, for example, if you target the spike protein and ignore the other things, then you get a very, very effective immune response. Now, people keep saying, you know what, these vaccines are not safe. But actually what happened was like in December 2019, when we first got the first case of coronavirus in China, the Chinese by around mid to late January had discovered the whole genetic code of the coronavirus, and they published it on the internet. And in the next 24 to 48 hours, 270 different companies started developing vaccines for it, targeting the spike protein. And of those 270 companies, only around 180 passed the lab tests, and then they went to start giving trials in human beings. So we have what we call phase 1, phase 2, and phase 3 trials. All of those are meant to show if one, the vaccine is effective in humans, or is it safe in humans. So only 28 we approved to begin phase 1 trials, and they also went to phase 2 trials, and 21 went to phase 3, and of those phase 3, only 4 were approved by WHO. That was around Jan last year. We only had 4. Sorry, not Jan, April last year. Right now, we have 5. I think the Chinese, one of the Chinese vaccines was approved by WHO. So right now we have 5 that have actually gone through all the development. And each of these phases is very, very stringent. and only 4 or 5 right now actually have emergency use authorization, as we discussed earlier. So yes, the vaccines are actually very safe, and there's a lot of data, safety data on them. And we don't just put them to humans and say you take, because many people think we overrushed, but actually no stage was ever skipped in bringing these vaccines to the population. Currently, there are 8 types of vaccines in use. Most of them were developed in 8 months. All of them are, as I said, are under emergency use authorizations. They use new technology. We'll talk about technology in the next slide, but these are just the vaccines. We have the Covaxin, this is made in India. We have the AstraZeneca, which is also made in India and in Europe and in US. We have Johnson & Johnson. We have the Sputnik 5, which was the first one to come out in August last year. We have the Sinovac, which is Chinese. We have the Sinopharm, which has just been approved by WHO. We have Moderna and Pfizer, which are American. Right now, I think there is the Cuban one, which is coming out as well. So there's a lot of vaccines which are actually there, and most of them use almost the same new technology. If you look at the different types of technology of vaccines, the important thing is the storage. You can see this Pfizer, you need -70, the Moderna, you need -20 degrees. We only have one fridge in Uganda which can handle -70 vaccines, and that is at Entebbe in Uganda Viral Research Institute. And so, for example, when Biden donated 60 million, 11 million Pfizer drugs, Uganda wasn't amongst the countries that received these Pfizer vaccines because they had already declared WHO that they cannot handle -70 logistics. So this is very important. The also good thing with the Johnson & Johnson, this one down here, is you only need 1 dose. And I think Uganda has just acquired through the African Union around 250,000 doses. The Johnson & Johnson, there you only need 1 dose, so you don't need 2 doses like the other vaccines, which is a good thing in Uganda. Then this one is just comparing vaccines to the other vaccines. I think this one I don't need to go through it so much. And also this one this just talks about how the AstraZeneca works. Basically, they took a virus that causes flu in chimpanzees, but doesn't cause issues in human beings. And then they got the DNA of the spike protein in the coronavirus and inserted it into this chimpanzee virus to form a chimpanzee virus which expresses the DNA of the spike protein. And then that's what they inject into you. And then it enters you, and then your cells make the spike proteins. And once the body sees those spike proteins, it forms antibodies against them. So that is really how AstraZeneca works. It's a bit complicated, but there is no virus, there is no coronavirus in the vaccine. This is important because some people have been asking, but Musawa, why don't we first test to see if I already have the virus? Because if I already have the virus, you see, the issue would be I might fall sick. No, you won't, because the vaccine doesn't have the coronavirus. Okay, there are some conditions, for example, if you're vaccinating for yellow fever, you're vaccinating for TB, where if you give the vaccine of TB and yellow fever and you already have TB, the TB can become even worse. Okay, so here you don't need to test whether to see whether you have the virus or not, so you vaccinate. That's number one. And number two, if you have been infected and you're just recovering, you don't need to first wait. You can even go the next day that you turn negative. And the only reason we tell you to wait until you turn negative is that you don't spread the virus to other people as you go and get vaccinated. Because many people tend to pick the virus as they go and get vaccinated. If you remember the pictures in Kololo, there were like 30,000 people being vaccinated in one day. So you go, you want to get vaccinated. If 10% of the people have the virus, you have 300 people spreading the virus, and you end up catching the virus. At the day you go to vaccinate. Even the nurse themselves could spread that virus to you. So the vaccine does not cause coronavirus. It's something that very many people have. Of course, the vaccine is generally cheap, and it causes. These are just some of the fringes that Pfizer has needs, and as you can see, they cost upwards of $10,000. Is the vaccine safe? Yes, it is. The vaccine is very safe. You are more likely to die of a car crash. You're more likely to drown. You're more likely to be murdered, and you're more likely to die in a car accident than you are of clotting from coronavirus. We always concentrate on the clots. There are other side effects of the vaccines, mostly pain on the injection site, fatigue, headache. Something that we're also seeing lately is that many of the menstrual cycles of the females tends to be disorganized. So some people might experience either heavier bleeding or lighter bleeding, or the length of their cycles either lengthens or shortens, but it doesn't cause fertility. Now, this slide basically talks about that the second dose causes more. The second dose causes more side effects, but actually in real life, the data has shown it's the other way around. The first dose causes more side effects than the second dose. And so this was a small study that was published January 14th. But actually, in real life, when we've seen many people, the first side effects tend to be worse, and they tend to only last within 24 hours, 48 hours, and very, very rarely 72 hours. Side effects are there, and they're beyond just the clotting. Have any side effects? I always tell people, go to the National Drug Authority, report to them. They have a hotline which is free, or just send a able to follow up with you with your batch numbers. And some people talk about effectiveness of the vaccines. Yes, they're actually quite effective. If you look at this slide, you'll find that this is the UK, where they have a lot of data on AstraZeneca. That's why I brought these UK slides. What you're seeing is that January, when they had a very big wave and not many people in England had been vaccinated, the majority of people in hospital were over 65. But once the vaccination happened, you can see that the over 65s were now the least people likely to be in hospital. And now the majority of people who were in hospital were the under 65 who had not been fully vaccinated, but also the proportion of under 65s are much higher in the country compared to over 65. So this shows that the vaccine actually works. Then the issue really that tends to disturb people is that this new Delta vaccine tends to be much less effective against vaccines. Yes, in terms of first dose, but in the second dose, it's just as good. For example, if you look at the Alpha and the Delta, this looks like a complicated slide, but it's not. Dose 1 for the Alpha protects you around 50%. Dose for the Alpha, it protects you between 30 to 35% from getting symptomatic disease. And those two up to 90%. For the Alpha variant, those two, for the Delta, it protects you 80%. This is just for symptoms. Then for hospitalizations, you can see that even one dose might be good enough compared to no dose. So against severe disease, the dose 1 is protective 80%, dose 2 is protective 96%. And this is UK, this is UK data. Ugandan data, this data came out 2 weeks ago when the Minister of Health gave us feedback, because people were saying, you see, many people are dying, yet they were vaccinated. But you'll actually find that of the people admitted to Mulago and Entebbe COVID units, these are the largest COVID units in Uganda. They looked at 200 patients, and of those, 189 or 94% had never been vaccinated. So these were hospitalized in Mulago. These are the sickest patients around, and 94% of them had never been vaccinated. And then for those who had been vaccinated only by one dose, it was 5.5%. And there had been no one, not even a single Ugandan who had been vaccinated twice, had been admitted in Mulago and Entebbe. So this proves that many times people might say, yes, I was vaccinated, but actually they had never been vaccinated. So this shows that actually for those who have been immunized, who have been vaccinated twice, your likelihood of ending up in Mulago or Entebbe or any other place is extremely low if you've been vaccinated twice. This is just something to also put there to show you. This is just, maybe I can skip this. This just shows you in a hospital in India. It shows you that the people who were vaccinated anyway, this one is just showing you that people, the doctors and the nurses who had been vaccinated were less likely to be hospitalized. So you can see 3% of vaccinated people vis-a-vis 79% of unvaccinated people ended up in hospital, and then 0% ended up with the severe disease, vis-a-vis 2% who end up with severe disease were unvaccinated. This goes to show that the vaccine is extremely effective. We chose India here because that is where the Delta variant is, and they also used AstraZeneca. So why is this important? People also confuse people confuse vaccination with immunization. Okay, so this slide just shows you the effect of the vaccine once you take it. Okay, people think that the day I get vaccinated is the day my immune system will be very strong. No. When you take the vaccine, it takes around 10 to 14 days for you to start having any sort of reaction in the vaccine. And taking the vaccine, by the way, does not reduce your immune system. I've had many people saying, you see, when you get vaccinated, the immune system becomes low. No. You look at this slide, you will find that for the first 2 weeks, you have exactly the same immunity. Yeah, you end up having, sorry, I'm just removing this gentleman here, or the lady, whoever it is, who has been writing funny things. Let me just move to something else. Guys, just give me a second. Just give me a second. The person who's been
Doctor, while you clear the screen.
I'm about to finish, I can promise. Yes.
Yes.
Yes. Sorry, you're saying something?
I was saying, while you clear the screen, could you summarize?
Yes.
So that we can have time for other presentations.
Yes, I'm about to finish. Sorry about that again. So this vaccine, this is just showing you that on by week 2, your immunity is almost zero. So people get vaccinated and then they go play around, go wherever they want to go after they are vaccinated, yet actually their immunity is at zero. If you want to get vaccinated, if you want to get the proper vaccination, the proper rate of protection, you need to wait at least 3 weeks after your second dose. So assuming your second dose was at week 12, okay, you will only get your full vaccination 3 weeks after week 12. And people forget that. So many Ugandans will get their second dose at week 8. So usually by week 11, they are fully vaccinated. But also the longer you stay, then the longer the duration between dose 1 and dose 2, the more strong your immune system is. So for example, some countries like Canada and Spain, they give you your second dose at week 16. There's now a new study which came up and said even taking your first dose at week 1 vis-a-vis, and then your second dose at month 10 or week 50 or week, month 54, month 10, you're more likely to get a much better immune response than if you just took the second dose after 4 weeks or 8 weeks or 12 weeks. So the longer you delay your second dose, the stronger your immune reaction. But remember, your highest immune response will be 3 weeks after your second dose. Please always remember that, because many people feel that when they get vaccinated, they are already immune. Pregnant women, we're now in other emerging issues. Pregnant women, it is safe to take vaccine in pregnant women. It is safe to take vaccine in breastfeeding women as well. Initially, we had said don't do that because the data hadn't come out. Now the data has come out. And unfortunately, what I've found is that many people who are vaccinating are chasing away pregnant women and breastfeeding women because that information hasn't reached them. But we already know that it is actually safe both in pregnant women and in breastfeeding women. Previously infected, maybe let me not talk too much about this, but you can still get the virus if you've been previously infected. If you get vaccinated, your immune system will be 6 times stronger than somebody who has not been vaccinated. And so it is important that you get vaccinated, even if you've ever had the coronavirus before. Some studies are saying that you may not, your immune system against your immune system, once you get vaccinated once, is so strong that you might not need the second dose, but the studies are just starting to explore that question. I discussed this, telling you that actually the coronavirus, the vaccine does not have the coronavirus, so it cannot cause disease. Then there's something called, maybe the second last thing is mixing vaccines. So for example, taking the first dose as AstraZeneca and then the second dose as Pfizer. This is now has been found to be much more, to be good. You can actually do that. In fact, the German Chancellor, the Canadian Prime Minister have had that where they took their first dose as AstraZeneca, their second dose as Pfizer, and the immune reaction has been much stronger than, for example, if you've only taken AstraZeneca alone. However, the side effects tend to be much greater if you do that, but they only last around 48 hours. Then the other thing is, so some countries, as you can see, this is just countries which have now decided to mix the vaccines. This is Thailand, Italy, Canada, Bhutan. So soon we might end up going to mix vaccines. You might find that the Chinese vaccine comes into Uganda. You've already taken your AstraZeneca. Don't say but you see, but you saw. No. The studies have shown that actually you get a much better immune response. Then the need for booster doses, a study just came up saying that it is having a booster dose after 6 months is important, is actually important, and especially once the variants become many. But the problem is that we don't want to discuss booster doses when there are other countries which don't even have vaccines. So there might be a need eventually to have a 3rd, 4th, and 5th dose of the vaccines. And this is just the study in Oxford, which is just talking about that. Yes, so Israel is already discussing about the booster dose. Then the last thing I want to discuss before we go, because I know I've taken too much of your time, is many people are talking about AstraZeneca being banned in Europe. It is not that it's banned in Europe, it is because AstraZeneca, the Serum Institute in India did not apply for emergency use authorization in Europe. And what happened was the European Union said, we only recognize countries of which we have approved that the vaccine. So for example, AstraZeneca is made by 2 different organizations or different. So there's the Serum Institute in India, which sells its things to COVAX, and then the Ugandans and Africans and the poor countries take it. It also sold it to the UK. They sold 10 million doses. and the UK people also used it. Then there's also the Vaxzevria, which is AstraZeneca. It is made in Belgium, Netherlands, and the UK. It is sold to the UK, the EU, and right now South Korea is also starting to make both types, the Covishield and the Vaxzevria. And in fact, the vaccines that are coming in August are going to be coming in August in Uganda are going to be made from South Korea. So right now, the EU, the only vaccines it recognizes is the Vaxzevria, the Pfizer, the Moderna, and the Johnson & Johnson. But unfortunately, as I said, Serum Institute had applied to the EU because they didn't expect to sell it to the EU. So now it has applied, and we expect that by the end of July, EU officially would have recognized it. Currently, these are the countries which still recognize the Serum Institute, AstraZeneca, what called the Covishield. There are around 15 countries. So even if the EU officially doesn't recognize it, the countries inside the EU, many of them have actually recognized the Covishield. And recently, I think a week ago, an EU delegation basically said that approve all WHO vaccines to the EU, including Covishield. So it's not that it has a lower quality, it's just that Serum Institute hadn't applied. So finally, this is just where to vaccinate from. If you're in Kampala and if you're in Wakiso, this is where also to vaccinate from. And this is myself getting vaccinated at the beginning of the vaccine launch in Uganda. So thank you very much. And again, I apologize for having a very long presentation. Thank you very much.
Thank you very much, Doctor, for that wonderful sharing. I'm positive that everyone listening in has been motivated or has had a change of mind about getting vaccinated. I request that you stick around to answer people's questions. If possible, there are some in the chat which you could reply as we move on to the next presentation. Yes, and then
Patience.
Yeah, yes, please.
Maybe I can read out the
Can you hear me?
questions. Yes, we can. Maybe I can read out the questions so that he can be answering in the chat room.
Okay. I'm giving you 2 minutes to do that before we move to our next presenter.
Okay, we had Persis ask, is it true that instead of oxygen, some people are given carbon dioxide in the hospital? Then Isabella requested that if the positions for sleeping can be reshared, it could help out. Then we had Mercy. She asked, is the COVID vaccine safe for the young children below 12 years? Then we had Linda ask, can people with pressure take the COVID vaccine? Then let me check out, there are more coming in. I can see Anna Christine has said there are several painkillers. Can any be used or it is only paracetamol? Some people may respond to those that contain aspirin, caffeine, and paracetamol. Then we have Mercy. She has asked, how long should you take after your vaccination before going for another one after some long period? Then Isabella said, but when I got the first vaccine, my breathing became fine. And then the rest are coming to appreciate the presentation. Thank you very much.
Okay, thank you, Monica, for that. Let's invite our next presenter, who is going to handle issues with mental health. You know how Doctor has been talking about COVID and how it has different strands and different vaccines. You may be disturbed by all this, and you're probably wondering how you can keep things together even when you get COVID, or if you don't know if you're going to survive through it all. But Sarah is here to encourage us and show us how to keep mentally sane during this time. Over to
Thank
you,
you.
Sarah.
Thank you so much.
Questions? Sorry,
Yes,
Sarah. Can
please.
I request Dr. Tumwine to maybe answer the questions before Sarah can come in so that we can
Yes.
close that chapter?
Okay.
I'll do so in like 2 minutes because I know I've already taken people's time. For carbon dioxide, I don't think in hospitals we give carbon dioxide. First of all, even the types on the colors of cylinders of carbon dioxide and oxygen are completely different. Carbon dioxide, you die if you get carbon dioxide even within a few minutes, both carbon dioxide and carbon monoxide. So they're quite dangerous. And this is one of the reasons we don't encourage people to use oxygen at home. I didn't go into that, but there's a whole thing of why you should not use oxygen at home. Even using too much oxygen is also a bad thing, by the way. It can cause what we call oxygen radicals, which can end up causing issues in your body. For sleeping postures, the important thing is about sleeping on your tummy. It doesn't have, there's no skill to it, there's no whatever. Sleeping on your tummy versus sleeping on your back is very important. It's more important to sleep on your tummy because it opens up your lungs. So it's very important that as much as possible, you sleep on your tummy. Is corona vaccine used in children? The only issue is the studies. That's all. Usually when we bring in a new drug or new vaccines, the two vulnerable populations are pregnant women and children. So until we know that a vaccine is useful and safe in adults, we then test it in children and pregnant women. So the studies for pregnant women have come out. Studies for Pfizer, particularly for children, have come out. So Pfizer, for example, you can, if you have the Pfizer vaccine, you can give the vaccine for children above 12 years. AstraZeneca, the studies haven't yet come out, but they'll come out very soon. Hopefully it will show that actually it is also safe in children, but I cannot recommend that you take you be vaccinated. You vaccinate children below 18 because the studies haven't come out, even though I know that some of the studies have shown very good results, but once they've officially come out, we'll be able to do that. Yes, people with blood pressure can also take the vaccine. There is no particular issue. You raised someone raised a very important point about painkillers. I remember I only mentioned paracetamol. I haven't mentioned diclofenac or brufen. The reason is, remember that COVID can cause clotting, and that clotting is common in the brain, in the lungs, in the heart, and in the kidneys. The kidneys specifically can shut down. In fact, that's one of the commonest causes of why people go to ICU. And diclofenac and brufen can also damage the kidneys. So you don't want to be damaging the kidneys from COVID, and then you give brufen or diclofenac, which also damage the kidneys. Also, diclofenac and brufen cause ulcers. Some of the medications that we give for severe COVID also cause severe ulcers, so that can even end up worsening your condition. So please stick to paracetamol and that. There's been a study about aspirin, because aspirin is an anti-clotting drug, but it has been shown that there is no effect of you giving aspirin to prevent clotting in COVID. So don't have to do that. How long after vaccination? How can we vaccinate after a long period? Anytime. For us, we don't have the luxury to wait for 10 months. We don't have the luxury to wait for 16 weeks. We don't have the luxury to wait for 12 weeks. The moment you have a vaccine that is available to you in Uganda, please go for it as long as you have reached 8 weeks of vaccination. We don't have that luxury because we don't manufacture vaccines, and all the other countries have taken up our vaccines. So thank you very much. I think those are the questions I had.
Thank you, Doctor, for answering these questions in the shortest time possible. Yes, I'm sure people's questions have been answered, and we now have solutions to some of those issues we've been having with vaccination. Yes, over to Sarah Namutebi.
My issue hasn't been answered. My question.
Monica.
What's that, please?
My question hasn't been answered.
Which question was that?
I did ask about, I said that I've been having like some kind of chest issues. And then when I went for my first vaccine, I did not feel those struggles with breathing after that. But then towards getting my second vaccine, I've been having issues, chest issues, struggling with breathing. So I've not yet gone for my second vaccine. And I was asking if there could be any issue or I should wait longer because I was supposed to go on 30th of June.
Okay, Isabella, it depends on what, because I think the important thing is to find out what is causing the worsening breathing, but generally it shouldn't disturb you because as I mentioned, if your breathing is being caused by any other thing, it could even be a clot, it could be anything else. Getting the vaccine is not a bad thing because the vaccine doesn't have coronavirus. The important thing is to get a vaccine in a setting where you're unlikely to meet many people and be given the virus. So I don't know what caused your worsening breathing, but it's important maybe to find out why. But it is not a contraindication for taking the vaccine. The only contraindication, by the way, for not taking the vaccine are two. Number one is if you have allergy to the components of the vaccine, and the vaccines and the allergies usually is previous allergies to previous vaccines, but also this vaccine contains certain products which you can which you have in makeup and in frozen foods. So if you're allergic to frozen food like yogurt, or you're allergic to makeup, you need to be sure that you're not getting this vaccine, or at least they check the vaccine. In fact, when you go and get vaccinated, they wait for 30 minutes to make sure that you don't get an allergy. But those are the only contraindications, or those are the only things that should stop you from getting the vaccine. They said the third one is if you're already hospitalized and you're positive, and then the other one is if you're a child. But everything else you can get the vaccine. Everything, every other time you can get the vaccine.
Thank you so much.
No problem. I don't know, Isabella, I don't know if I've answered you properly.
Thank you once again.
Yes, you have. Thank you so much, Doctor.
Thank you again, Doctor, for giving us your time. Yes, if there are no further questions, no extra questions, we'll continue with our conversation. Yes. Our next conversation is on mental health, and Sarah Namutebi will be taking us through this session. Yes, for the remaining minutes that we have, I request that all the remaining presentations are done in about 20 minutes. Yes, we are still anxious to listen.
I'm going to start.
Patience, do I begin? Is everything okay?
Yes, Sarah, you can start.
Okay, great. Good afternoon, everyone. And thank you very much, Patience, for introducing me. And thank you so much, Doctor. I believe now people are somehow calm and know where to go for more information and so on about the vaccination. So thank you so much for that very informative presentation. Hi, everybody. I don't know if everybody heard my introduction before, but my name is Sarah Namutebi. I'm a social worker by profession. I've been doing social work and working within the community with young people, children, families, and adults, and dealing obviously with mental health. My experience, my practitioner experience is mainly based in the UK, but I'm very happy to be here to share with you just some few topics on mental health and how do we handle our mental well-being during the lockdown. So Madame Kathy, I don't know, or Rita, I don't know if you have my presentation. If you can please share that for me. If you have it. Madame Kathy, can you all hear me?
I
Yes,
can
we
hear you. Let me check my email and see.
Okay, all right, no problem. As Madam Kafi does that, I will begin. I'm going to turn off my camera just sorry, because a few minutes ago my internet went off. So I don't want for you to miss the presentation or any interference. I'm just going to turn off the camera, but I am here. But just for you to see my face and to see who I am. So hi, but I'm going to turn off my camera right now. Okay, thank you. So as I wait for Madame Kathy, as I said, and also patience, one last question. Am I going to be able to do the presentation, the quiz, or should we use another format?
Pardon?
Will I be able to do my quiz, or should I be creative and use another tool?
Is it quick or?
Yes, it is quick. It's within the time.
Yes, then I think we can do it.
Okay, no problem. All right.
Keep us active and awake.
Exactly, yes. So as we said, I'm here to talk to you today about mental health and just our mental well-being. So I'm not going to be using the word mental health a lot, but I'm going to be using mental well-being. And you may ask yourself, okay, why do we need to talk about mental health when we're speaking about COVID, the pandemic, and so on? I would say that mental well-being goes hand in hand with our physical health. They are both very important. You can't have one without the other. And as we know, today, the COVID, the pandemic, has affected us greatly with our mental well-being and just generally our mood and how we feel and what we are thinking about what's happening in the world and what's going on around us and how it is affecting us. So before I begin with my presentation, what we're going to do, we're going to be a bit creative. As Girl Guides, we are always prepared. So I'm going to please ask you to use your chat box and just tell us what's the first word that comes to your mind when somebody says the words mental health. What's the first thing that comes to your mind, or what word comes to your mind? So if you can please put that into the chat box. So that's for you, our viewers. Depression, okay. Yes, thank you very much, Procy. What else? What other word comes to our mind when we hear the words mental health? Or when you hear the word mental health, normally, what do people say in the community? Anxiety, sad, okay? Thank you, Elizabeth. Crazy, yes. Sadness, okay. Thank you. So just keep them coming in. So as you can see there already, stress, thank you. As you can see there already, when we talk about mental health or mental well-being, unfortunately, within our community, it can have a very negative effect. Like the words that we use in itself sounds really negative, and they are negative. As you can see, crazy, stress, depression, those are not positive words. And I guess this is one of the reasons as to why mental health has a quite negative stigma in the community and people don't really talk about it. So today I want to differentiate for you the difference between mental health and mental well-being. So as I said before, our mental health and our physical health are both interlinked. You know, they go hand in hand, they go together. You cannot have one without the other. Yeah, so we need to also understand that. I think if we understood that, then that would help us to really know, oh, mental health as a topic, as an issue to discuss is absolutely fine, because at the end of the day, we all have a brain. Mental is dealing with your brain, it's dealing with your brain. So if we don't discuss what's going on within our brains, then we are actually ignoring our brain and saying we don't have a brain, but we do. We have a brain and we have emotions. And those are things that affect us on a day-to-day basis, and we need to discuss them. So that's why we were thinking that today really it's really important for us to also see how has our mental well-being really affected us during the pandemic. I think, I don't know, okay, maybe Madam Kathy, you're not able to find my presentation yet, but that's okay. We'll keep going. So as I said before, our mental health is the same as our physical health. Sometimes you will have extreme circumstances where you have mental illnesses and mental diseases. That's not what we are discussing today, but today we are talking more of our mental well-being, which is something that allows us to function on a day-to-day basis. It's how we live, it's how we communicate with each other. So sometimes you will see, you may have experienced or you would have come across people with severe mental illness and mental diseases. So physically, they are moving, they are walking around, they can talk, although when they are talking, they may not be able to, they're not really making sense in what they are saying, or they appear to be confused or sometimes dazed and out of it. That is the severe mental illnesses that we have in our community, or the severe mental diseases that we have in the community. And we have different variations like schizophrenia, depression, anxiety, and so on. But those are the severe ones. But today we're talking more of our mental well-being. So our mental well-being refers to our mental health. It's a state of being mentally well in which an individual realizes his or her own abilities to cope with every day-to-day activities. So we all know, you wake up, you get up from your bed, you make up your bed, you go and you brush your teeth, you bathe, you dress, and you go out to work. That's you mentally knowing, as an adult, these are the things that I'm supposed to do in order to be able to function in my day-to-day life. And then there is the other of being able to function productively. So you can have mental health just the same as COVID. You can have COVID and move around and think, oh, but I feel fine. I don't think I'm sick, but you're moving around. The difference of where you know whether you have a mental illness or mental disease or whether you're mentally well is, are you able to function in the world normally? Like, can you do a task that you would normally do or majority of the people in the world do effectively and productively? Like, can I get up and cook something and I'll be able to cook that meal, not burn anything, you know, and everything goes well and I can enjoy my meal and it's wonderful and it tastes great at the end of cooking? Or am I cooking and I'm absent-minded and I end up burning everything and sometimes even setting your house on fire? So those are the two differences. Or do I get out of my house and I'm fully clothed and I look presentable? Or do I leave my house and I've just got underwear on? Those are the differences. And then also we have, how are you as a human being able to interact with others in your community on a day-to-day basis? So sometimes, like, if somebody, can you have a conversation with someone and it makes sense, it is structured, it's well put together? Or are you opening your mouth and you're talking gibberish and somebody doesn't understand what you're saying, but you know, you're functioning, you're walking, you're looking at people, you're talking to people, but that doesn't mean that it's productive and it's making sense. So that's where the two comes in. And it's very important for us to be able to differentiate those two so that you can see when somebody needs to get help. And you can also know for yourself, you know what, something is off. I don't feel like my usual self. Sarah's not me as Sarah. I don't feel like Sarah today. Something doesn't feel quite right. That's how you're able to test whether you're having a mental, you're mentally well, or you need some extra support to make sure that you're mentally well and you can function in your day-to-day life. So this is why it's important that we really have to look into our mental well-being during the pandemic, because as we all know, the pandemic has disrupted our whole way of living, not just in Uganda, but all over the world. It has literally disrupted everything we know to be normal. So for now, I would like you to please close your eyes, and we're going to do a little test, not even a test, but just a little game. I want you to picture yourself standing on a ladder. Maybe you're putting up some curtains, you're putting up a picture, and you're cleaning, but you're standing on a ladder, a very tall ladder. And then all of a sudden, wind comes, and it's a very heavy wind, and it shakes that ladder. That is our mental well-being. Yes, so you're on this ladder, you know what you're doing, you're in control, you know, I'm putting up these curtains, everything is fine. But all of a sudden, something comes along and shakes you, takes you off track from your normal day-to-day activities, from your normal day-to-day mood swings, from your normal day-to-day how you interact with people. This is what the pandemic has done to us. And we need to think and stop and say, okay, there's a disruption in my day-to-day activities. You can please open your eyes, and you can, and I hope from that small activity, you can see that, okay, just any little thing that happens during the day can take you off track, can take you away from being your normal self, can take you away from having the normal interactions that you have with people on a day-to-day basis. This is why we need to talk about our mental well-being and where we are, and just check in with each other. So I hope from there we have understood what a general mental health well person looks like, how you are able to function, and how a mentally, I don't want to say mentally ill, but a person that needs just extra support with their mental health would function as well. We are going to go into the next slide. Madame Kafi, if you can please go on to slide number 5. I see you now have the presentation. As you look for the slide number 5, I will continue to go on. So as I was looking through mental health in Uganda and just what's been happening during the pandemic, I came across a few research that was saying, keep going. The next one, that's it. Thank you very much. I came across an article from the World Health Organization saying that Uganda has ranked in amongst the top 6 countries in Africa to be having the highest rate of depression within Uganda. And within that, it's that women are mostly affected by mental illnesses within our community. They rate a lot higher compared to our male counterparts. So women are more likely, are 5.1% more likely to be affected by mental health issues than our male counterparts. And then of course, during the pandemic, we've seen a higher rate of suicide, for example, because there's a lot of job insecurities. You know, some people have been told, you go home, for instance, our teachers, and we have a lot of teachers in our Girl Guiding Association, they've been affected greatly by the pandemic. We've been told schools are closed, you have to go home, you can't go to work. And unfortunately, we've had a lot of suicide rates going up in Uganda because of the pandemic, and people just not knowing how are they going to survive? How do they look after themselves? How do they look after their families? Because a lot of us have responsibilities. Then we've had an increase in domestic violence and of course other forms of gender-based violence within our community. Other people have had a loss of sleep, insomnia, anxiety, and depression. This is, for now, just with the research that I've gotten, this is how we have been affected within Uganda during the pandemic. But of course, there needs to be a lot more research into this area and to know exactly how people have been affected with their mental well-being during the pandemic and which regions and so on. But I guess that's an area where we need a lot more support on from all health organizations in Uganda. But from that, as you can see, the pandemic shook some people up. You know, it took them off that ladder where they knew what they were doing, they were stable, they were confident. The pandemic has now come, and it's almost like it's that wind that has knocked us off that ladder. And we're now like, what's going on? There's a lot of anxiety. So this has caused a lot of anxiety, a lot of depression, where people are not knowing what's happening. We're in a lockdown right now. So people are guessing, is the lockdown going to be extended? Would this be the, I mean, I don't even know how many more days we have to go, but you know, we really just don't know what's going to happen. People don't know whether schools are going to open up again. Parents are asking themselves, what do we do with our children? And it's great that our next presenter will share insight onto that. But many people are asking themselves so many different questions, so many. And yes, some of us, we've been able to work from home, but even that is not so effective. We live with family members, we have people at home, or your neighbors are home and they're playing very loud music or their TV is on. That you're in a Zoom meeting presenting and a child walks in and wants your attention. So even for everybody around us, we are all trying to cope to our best abilities, but it's added on extra pressure, you know? So for some of our parents, yes, they are working from home, but the children are seeing you at home. So they're like, well, you can't be working because you're at home. You normally work in the office. So therefore, you know, we can play, we can go outside. Some children are not fully understanding what this whole lockdown is, what the pandemic is. Where other children, I had a 18-month-year-old, somebody in my family sneezed, and this 18-month-year-old got up and said, oh, Corona, and she ran away into the next room. So even for children as young as that age are understanding, oh, there's this thing, it can kill you. So we have to be careful. So how does that impact on our mental well-being? Some people have gone to the extent of, yes, we have to social distance, that is true. But some people, I know that when I'm outside in my community and I walk past people, even with my face mask on, I've seen some people move a distance from me. You know, so it's made people fearful. People are unsure of everything, and that will affect us. So we need to be aware of what this mental well-being is. How do we make sure that we are protecting ourselves physically, but also mentally, to make sure that we can still function within our community and function productively. Madame Kathy, maybe if you can please go on to the next slide. Okay, as you do that, I will go on. But also, I'd like to ask you to our guest and panelists as well. How have you handled your mental well-being during the lockdown? Like, what have you been doing to make yourself just be in a good mood, to be able to function, and so on? What have you been doing to make sure that you're mentally well? I'm asking that question to you, and if you can please put it down into the chat. Because I was going to use our phones to do this, but just for time, maybe we just put it in the chat just to save time. So what have you been doing at home to make sure that you are mentally in a good space? What have you been doing at home with your family, or what have you been advising others to do as well? So if you can hear me, you please just type that into the chat. So for myself, for instance, I've been going out for long walks in my community. So for you, what have you been doing at home to make sure that you're mentally well? Okay, so stay in touch. Stay in touch. What matters the most in my life? Stuff like family, faith, etc. Okay, so some of us have been making sure that, right, I want to make sure that I'm in touch with my family, my friends, and my faith is still present, because that's really important to me. That's great. Thank you so much for that, Godfrey. Keeping busy by learning something new. Great, exactly. So all of you, most of you, I think we are both all on the same page, telling stories, okay? Next time we'll give you the platform and you can tell us stories. Road work, okay? We go out with the kids. Yes, that's true. That's really good as well. So yes, we're in a pandemic, and if you're able to see my screen or Madame Kathy's screen, just some advice on what we've been looking at to see how can we better care for ourselves during this lockdown, you know, because number one thing we need to know that it's not over. We need to have hope and stay focused that everything, you know, everything has a beginning and an end, and this too shall end. This too will come to an end. And in the meantime, here are some things that we've put together just to help you with how to survive the lockdown. So we've said that you should try to focus on the things that you can control. You know, like things like, oh, when will the lockdown be lifted? Is it going to be extended? You cannot control that. You have no control over that. And stressing and overthinking this would give you anxiety, can also make, can have a negative impact as well on just your mood. You know, you've been, I'm fed up of this thing. I just want to go out. I want to go out and, you know, to the bar or have a drink with my friends. You have no control over that. So stick to what you can control. Another thing we suggested was that maybe you should come up with a daily routine for yourself. So not to go to bed like 4 o'clock in the morning, staying up watching movies, and then you wake up very late in the day. You know, the day is almost gone. You haven't seen the daylight, you haven't seen the sun. And sun is so, so important. And this is something that has actually been discussed across European countries, because unfortunately for them, they don't have the pleasure of the sun like we do in Uganda 24/7. So that's something that we need to utilize, as sun really helps with your mood and just your general mental well-being. Okay, sorry, I thought somebody was wanting to say something. So please make sure that you design a routine for yourself. And if you have children with you at home, also design a routine for them. So you may say, okay, in the morning, we do our chores. We're gonna go and read, do some homework, studying at home, homeschooling, you know, those things. Then you go and make lunch. Then after lunch, we go back to study. Then in the evening, we'll go out for a walk. And later on, we'll come back, cook together, that kind of thing. So it allows you to still have a routine. Oh, sorry, I'm getting some feedback from someone. If you can please mute your mic. Thank you so much. So yeah, make sure that you have a routine so that you keep yourself active, and even your brain will be alert and aware and like, okay, we are still doing things. Things are still some kind normal, you know, to have some kind of normality. Try reading more or watching movies, but of course not for the whole day. Make sure that you do go out, get sunshine, and as much as possible, whilst following the SOPs, interact with people. Things like having an exercise. Somebody here said before, going out for a walk with the children, seeing the birds, rabbits, and so on. That's great, because that allows them to be connected and back with nature. So that's really good. Learning something new on the internet. There are so many websites that are offering free short courses that you can do in 1 week, and they are absolutely free. So take up those opportunities for now. Learn a new skill. You know, your brain is still there, it's active. So use your brain so that it doesn't become dormant. Then get to know your neighbors. If you live behind a fence, whatever, and you have neighbors, get to know them a little bit more, you know, find out how they are, what are they doing, how are they managing to keep themselves mentally well, and things like that. Oh, sorry, Madam Kathy. Okay, I will use my screen. How are they doing in this pandemic and things like that? Yeah, so keep in touch with your neighbors. Please, as well, at the same time, make sure that you are following the SOPs whilst doing that. And then somebody again in the chat box said, you know, to keep connected with family and friends. That is it's key. It is key. Even with our patients, unfortunately, going through the pandemic right now, keeping connected with family and friends is the number one thing that is going to get us through this. So yes, we may not be able to get in the taxis on a border in our cars and go and visit people physically, but you can do, if you have a smartphone, you can do something like setting up a family WhatsApp page that, you know, you just check in on each other. Hi everyone, what are you doing today? Or today I'm going to bake a cake, or I'm going to do this, or I've signed up to a free course online. So it still keeps you all connected, in touch with each other, and you don't feel too distant from each other, and that you don't know what each other is doing and all of those things. And of course, if you have the airtime, give them a call, give people a call, touch in with them, say, hi, how are you doing? What's going on? I'm doing this and whatever. Or have you seen this movie? I'll recommend this movie. I'll recommend this book for you to read. That keeps us connected. It keeps us informed of what's going on, and so on. And then the other thing, I think Dr. touched on this, the issue, the great big issue that's going on right now with fake news. And even the World Health Organization keeps on mentioning this. And I think that's why they've also restricted the number of sharing of information that's happening right now, because there is a lot of fake news out there, and you have to be careful what you read, what videos you're watching. And just, you know, just maybe just if you see something and you think, oh, you know, somebody says, I don't know, there is some medicinal herb out there, some new medicine out there that cures corona. Before trying it, before reading it, before passing on that message, please make sure that you go to like the Ministry of Health website to check if that information is true, or the World Health Organization, again, to check if that information is true, because you can get yourself actually more sick just following fake news. So please be careful of that. And for now, that is me. I am done. I hope that helped you. But please, if you have other suggestions on how we can better look after ourselves during the lockdown, do share in the chat as we are still here. But thank you so much for listening. And please be kind to yourself, be kind to your neighbors, and look after each other. Thank you so much for listening. Patience, back to you, please.
Thank you so much, Sarah, for sharing with us a few things about mental health. Personally, I didn't know the difference between mental health and well-being. Guys, to just sanity or something. Yeah, so if we have any questions for Sarah in regards to mental health, how to stay mentally stable, how to overcome depression during this lockdown, or something you'd want to clarify, please write it in the chat, and I'm sure she'll get back to us with the answers. Yes, so let's welcome our final panelist for the day. Yes, you're welcome to talk to us. He's going to be talking about homeschooling and how we can keep children's brains active during lockdown, this uncertainty, not knowing when schools are going to open and all that. Yes, over to you, Mr. Godfrey.
Thank you. Thank you very much, everyone. Sarah and Dr. Daniel, thank you for your sharing. That was very helpful and very informative for all of us. Like I said, my name is Godfrey Chaze, for those who came in later, and married to Olga. We've been married 13 years and we have 4 children between the ages of 12 and 3. And usually I say they have never been to school, in the sense that we've homeschooled them ever since. And our plan, Lord willing, is for them to leave the homeschooling system, possibly when they are going to college or university, because we think it's possible. We've seen it happen in some other parts of the world, but also even here in Uganda, there are families, there may not be many yet, who have done this. So homeschooling, in the context I discuss it, and in the context I know it, it's sometimes different from what people have come to know now because of the lockdown and the pandemic. And the idea is that it's something that is happening, and it's an old age phenomenon, if I may say. There are people who think it's a new thing that is emerging. I would rather say it's possibly re-emerging, but it has been there before. Even if we choose to go look at the history of our education, even here in the country, education has never been static. It has always come through different phases, or it has evolved over time. If you go back to the late 1800s, before we had formal education, we had what one would call the African indigenous tradition education, which was basically non-formal. It was largely community-based, and I would say pretty much home-based, like the kind of homeschooling we're talking about. The homeschooling we're talking about today is largely more modernized. But if we go back then to our traditional indigenous education, it was sort of home-based, parent-led, community-based, in terms of it was non-formal. People learned everything they needed to learn in order to survive in their society. But until the late 1800s, that's when we started seeing formal education come in Uganda, largely brought by religious bodies, like the Christian bodies. The church missionaries brought what we would call missionary education. The Muslim Arabs as well had brought their education here, which mostly was focusing on how they could spread their faith. And that's the first time we begin to see what you would call formal education, which required somebody in the name of a teacher who is sort of professional. They have some kind of a written curriculum, stuff like that. And that lasted from, let's say, the 1877 up to about 1925, when we had the Philipstock Commission. This was a commission that was put together to kind of study the education of Africans. And it took place in most of the Southern African countries, including the Eastern African countries. And it was after that Philipstock Commission that recommendations were made, among which included that the central governments, or the states then, should take up the control of the education system. So for us to begin seeing government or state-run education system, it was not until 1925 in Uganda. And that was characterized by being very formalized, highly standardized. It's when we started seeing an education which is examination-oriented and stuff like that. Now, the reason I'm taking us back into this kind of history is to say that education has never been static. Education keeps evolving. And right now, because of COVID-19, it could be that we are at that point in the history of our life that possibly we need another evolution in our education system. And this is the context in which I would love people to begin pondering and looking at homeschooling or home education, that it's a possibility. It can be an option. It may not be all there is or all that we need, but it could be an option that we do not need to brush off. After all, there are trailblazers, people who have gone before us, who have done it, even here in our own country. There are people who I know, not so many yet, but who have homeschooled their children from preschool through to high school, and they just leave their homes going to colleges and universities. Right now, as we speak, I am part of a group which we call Homeschoolers Uganda Group. And this group has over 230 members. These are Ugandans who are homeschooling their children. And this is before even the pandemic. Most of them are younger families whose children are below the teen years. So they've not yet gone so far, but they're a sizable number who we have this group where we come together, share experiences, but also share resources with one another as a way to encourage one another. Because education, as you may likely know, it has a side to which you cannot do it in isolation. It is a communal process. So having a group like this has been helpful. So I happen to be in the leadership of Homeschoolers Uganda Group. And one of the things we do is to bring together, come together, people who are like-minded, like-hearted, share resources. We do seminars or conferences every 3 months. Before the pandemic, would meet physically in a place, and parents come together with their children, and we sharpen one another as parents on how do you do this. Remember, these are parents who need a lot of encouragement. They are not necessarily trained educators. So when we come together, we encourage one another and share a resource, a skill here and there of how do you do this? How do you go about math? Where do you find curriculum? Those type of things. But also one of the things which we've tried to do by coming together is to see that we, among the resources we develop, because there's a likelihood that most times people who are homeschooling, they tend to use curricula which are not necessarily home-based or which are not Ugandan. There are many out there who are using international curricula. So one of the things we decided was, in order to make this a possibility for any other parent in Uganda who might be interested, there is need for resources or materials that parents can use, Ugandan parents, those who are not looking at taking their children outside of Uganda, or who may not afford it. So one of the things we've been working on is to develop materials or curriculum or teaching materials in form of textbooks that could be user-friendly to any parent or guardian or even a child themselves who is able to read and comprehend what they are reading, to be able to kind of be self-taught. And this is, I'll just show you a picture. These are some of the textbooks we've developed. We've been working for the last 2 years. We've had a project of developing 28 of these textbooks. 28 textbooks, that is considering the 4 main teaching subjects in our school system here in Uganda, times the 7 levels. Those are the 28 books. And by this time, we have so far finished 14 of those textbooks. They are out on the market. If you're interested later, you could share where you could find them. But what I'm trying to say that all these are things we are basically putting together to enable and help parents out there who are interested in doing this, and possibly they have questions or they are looking for where they can find resources. I did not necessarily prepare a presentation, but I know most times when people hear about homeschooling, they come with questions. They realize it's something they'll be interested in, but they have a variety of questions that they want to be answered. So one of the things that I do mostly with my team is to be available for consultancy for people who are interested in knowing what do I do, how do I do it, where do I find what, just to share information in that area. And for that reason, I would rather possibly end here and welcome, in case there are questions, I would flow better to answer direct questions people might have. But all I can say, it's possible, people are doing it, and you can do it. Especially those of you who have grown up into higher levels of learning, it is something we just need to encourage ourselves to do. Because many times I say that what trained teachers do or professionals do in schools to us is to pick textbooks like this and possibly read and interpret them for us. Something you can do for yourself if you are advanced at a certain level of education. I'm not saying there is no need for an expert or for someone you consult, but there are all kinds of tools and resources you can use to consult without necessarily having to go to a school if you must not go to a school, just like what the pandemic has done to us. I know there are many parents out there who need such encouragement. We have this mindset, we've always known that education is something that only happens in the hands of professionals in a classified place, in the name of a classroom, in front of a whiteboard or a blackboard with this man who has put on a tie. But I think we're at that point where we need to rethink all of that. Teaching and learning is something that can happen anywhere. And today, the days we are living in with resources online, just like Sarah has been mentioning, there are all kinds of courses you can do freely available online. That includes even all these academic courses we can do from pre-primary through to primary up to even university courses. There are people today who can do them all online. They could be available if you know what you need and how you can get there. I'll end with this statement. Philosophically, any good teacher, their job is not necessarily to teach someone what they need to learn, but to teach how to learn. So if we equip our learners with skills and the knowledge and the attitude of how they can learn, they will fend for themselves even beyond where their parents can take them. I know it's a challenge. Many parents, or many questions at times they come and they say, yeah, well, in Uganda, we have parents who cannot read themselves, they can't write. How do you expect them to support and help their children? It's possible. Once the child has been helped with the how to, other than what to, they will get to what they need by themselves. So raising independent learner could be one way that can see us making home education a possibility as an option to our education system. I hope that helps. Thank you very much. I would rather welcome questions from here.
Well, thank you, Mr. Godfrey. I'll start with the first question before Monica takes off. Before Monica leaves session.
Patience, what
Thank
are you
you
saying?
so much. I was just going to ask a small question before you continue. So when children are homeschooled, do they do UNEB like every other child, or there's some other form of, let me say, examinations they do to get to the next level of education? That's so. Over to you, Monica.
Okay, let's check on the questions in the chat room. We've had Frederick ask, how do you carry out assessment of learners? Then Sarah, she's asking how best to create a timetable for children to learn while at home. Then I also have a question. You mentioned about taking the learners to colleges. So do we have such colleges in Uganda that take up such learners who have been under homeschool? Yes, so far those are the questions I can see in the chat room.
Thank you. Yes, I want to begin with the first question. Do they do UNEB? Yes, it depends. What homeschooling does is that a parent is taking charge of the education of their child. Now, with that comes a lot of flexibility. there are many things you can do. You can choose to do a hybrid system where your children can sit UNEB, but as well, if you have access to international assessments, they can as well do international assessments. For example, the curriculum we have developed here, it is what we would consider a hybrid, in that we have benchmarked from international materials and as well local materials. Some of these parents I'm talking about who are homeschooling within our circles, they are pitching their children to do a dual sort of a system where when they come to that place of doing PLE or primary living exams, they want them to do that. They want them to do UCE and USCE. Because what it takes is that if my son, for instance, is at that level that they can do UNEB, all I need is to get a place where there is an examination center. I register them as a private student. They come for the days of the exams, they do the exams, and afterwards wait for the results. They come. I'm very confident they will pass. And then we get that paper and file it. Then we go back, homeschool them. They reach the next level of examinations, do the same. There's nothing that can stop us from doing that. But at the same time, they are open to doing international exams. So in the event that you want to take them to universities, you have the opportunity to take them to the university locally, but also the university internationally. That takes me to the other question regarding universities and colleges, because that is tied to what entry exams did you do. Most of our Ugandan universities and colleges, they take those who have done UNEB. But also we have a system, some universities, where they recognize international students who have done exams outside of Uganda. There's a system in UNEB where they can be equated. So all you need is guidance depending on what you want at the end of the day. Which kind of exit do you want for your child? You want them to go for college or university? Do you want them to go for some vocational trainings, all those type of things? Depending on which direction you want your child to go, that determines which route do you need to take in as far as examinations are concerned. But it's possible to do UNEB even if you've been homeschooled. There is nothing in our laws that stops someone to just come and register for UNEB once they find a center number where they can register from, and they do the results. And all that matters at the university, do you have the papers, UNEB papers, or if they're international, have they been equated by UNEB? So I think for those two universities and UNEB, that's how I'll respond to them. Those who have done international examinations coming to our universities, besides being that they're equated, there are some places where you can do certain exams that are recognized by some universities. Aga Khan, for example, is what some parents have done when their child reaches S5, S6, they have a program, a short course they do at Aga Khan, and then Aga Khan International School, and that course is called an IBM, International Baccalaureate Program. When you do that, most of our universities here recognize it. But then I know UCU also has a system in which it equates international students, those who have done SAT or SCT or Cambridge. There are universities that can recognize it. But also in Kenya, there are a number of universities that take on those who have not done national or East African exams. The other question was on assessment. What we do as homeschoolers, we encourage families to do continuous assessment and devising a system as a family on how you keep your records for your child, keeping a profile of your child. You can do that on a computer, you can do that in hard copy, and this could be pictures of activities the children are involved in. It can range from the exercise books where they are doing their daily routines and activities. But also you can come up with your own system of assessment and have an Excel spreadsheet where you record the different activities of what your children are involved in. So assessment, it is something that happens. All you need is to be deliberate at taking record and keeping that record so that in the event there is someone who has a question to prove whether your children are indeed learning, you have that evidence filed out somewhere. But philosophically speaking, assessment should not be the driving factor here. Even when we talk about them doing UNEB, we are not saying that UNEB should be the driving factor, the way it has become in our education system. We know schools that do everything just to have their children appear in the newspapers that they were the best, they got this and the other. I think the most important thing is to aim at ensuring that learning has taken place, whether you have a paper to prove that or not. The best proof that you have learned something is what you're going to do with your hands. That's the best proof. So that's the way we treat assessment, because there is need for a paper. Yes, indeed, we encourage the parents in our communities to ensure that they assess their children and keep records of that, but also that they work towards finding a route, an exit route, whether they will do UNEB or any other exam that could be a possibility. Lastly is timetable. Again, I want to say that when you choose to homeschool, as a sort of a caution, I would say that be careful not to bring school in your home, because the two are different. This is your home, it's your family, the routines are going to be different. You will not manage bringing a school system, this timetable, the way it is in the school. A lesson takes 40 minutes or 80 minutes, then another teacher comes in, then another 40 minutes, another teacher comes in. It does not work that way. The education of your children must be very much integrated with the life in your home. We call it a family economy. It's part of the family economics, because learning is not limited to only when you're doing math problems. Learning happens in the kitchen. Learning happens when you're laying the beds. Learning happens when you're taking the walk in the evening. Learning happens everywhere. All you've got to do is to be deliberate at what you're doing, to see that every moment is a teachable moment for your children. So what it takes is availability in the form of a parent, one of the parents at least, to be available with your learners or with your children, or if you have a tutor for that matter, to ensure that they're available, especially when the learners are still at their formative stages or their younger ages. They need somebody to guide them, to walk them through everything they're doing, even if they're playing. Play is a great, there are lots of learning opportunities when kids are playing, but is it deliberate play in the sense that there is somebody there to make sure the teachable moments are captured and they are seized instead of just being left to default. So timetable, every family can craft their own timetable. Of course, there are core disciplines, given the times we are living in, that I will encourage that at least every week or every day, ensure that you have had some lessons in arithmetic, into numeracy, if the kids are still younger, or math, or some science, or stuff like that, ensuring that you do not neglect them. But besides that, and you shouldn't be limited that, okay, a lesson should go only for 80 minutes. What you're aiming at is, has understanding taken place? Sometimes that could happen in 10 minutes and you move on to something else. At times it may take 2 hours, where the concept has not, the child has not managed to understand the concept, that you take a break and say, let's go for a walk. And maybe when you come back from a walk, he's now ready, the brain is ready. Or you realize, oh, well, he hasn't had breakfast yet. Maybe that's the problem. Let's first fix breakfast. And after breakfast, he's ready now. So it's different from the way it happens in the school. And one of the reasons why it's different, school is definitely very different from the home. School, just like you hear the word, to some degree, the word school came because of the circumstances, the industrial age times, where everything now was to be standardized and lined up on an assembly line. That's when we started seeing even the concept of humans being schooled, being brought together in masses. Every time you talk about school, you are talking numbers. Now, there is quite a huge difference when you're dealing with numbers compared to when I'm dealing with my 5-year-old one-on-one, or 2-on-1, or even 4-on-1 for bigger families. That's so different from when you're handling 50, and in our Ugandan case, we know cases where 100 kids are just with one teacher and the mango tree shade. So the dynamics become very different, even in terms of how are you going to timetable. I know most of the homeschoolers, by by lunchtime, that's 1 p.m. or midday, they are done with most of the rigorous academic instruction. And in the afternoon, they go into more relaxed things like play or doing assignments or doing some what you would consider non-curricular stuff. I hope that helps.
Okay. Okay, thank you very much. We have more questions coming in, and let me read them out. We have had someone ask, how do you manage to control the learners during classes? Then we also had patients ask, do you get random teachers or they are teachers specialized in this? Then Kathy asked, do you train all of them from the same room? Then we had Mercy say, it turns out most children don't concentrate while at home. How best can they take their attention into learning without getting distracted? Then also Sarah asked, how do we make sure that our children are not left behind in their education during the lockdown? Then also my question goes, there are many parents out there who wish to take up this homeschooling, but then do you have programs to train them on how best they can carry out this homeschooling? Thank you.
Thank you. Control children's attention. All of that is dependent on a key ingredient in education, whether it's in a school or in the home, that I'll call discipline. The biggest motivation, and which can as well be a hindrance to your ability to teach someone, whether it's in the school system or in a home-based system, is the discipline of your children. By discipline, in this case, I mean, if the child, I remember the days we went to school, if some of you remember, some of us, that what they would do for the school people to verify whether the child is of age, they'll make the child touch this other ear. And if you couldn't reach out to this ear, they would say, no, he's still young, he shouldn't. I think gone are those days. What I would say today, if you brought me your child to teach them, my test would be, I would ask you as a parent or as a guardian to give some instruction to this child. Let's say, go here, go pick this and the other. If they cannot obey, listen to the voice of the authority in their lives, and that's the parent, then there's a problem. And this problem is not for anyone else, but it's yours as a parent. That's the first thing we have to do, is to instill discipline in the child, for them to be able to listen to the voice of their parent. That way they will be able to listen to the voice of any other authority in their lives. I remember I told you we trained teachers going to a school where it was a kindergarten school, and this kindergarten teacher told this boy, he was about 4 years old, come and sit here. And the boy in Luganda retorted, Sija, meaning I'll not. 4-year-old is telling this grown-up woman, I'll not. But there are all these other children who need her attention. Guess what she did? She moved on to the others. Now, if she says, I will not, how do you convince me that later when she tells this boy 1 + 1 is 2, the boy will not say, I will not? So the basis for learning is discipline. Making sure parents, one of the things we have abdicated as parents is the discipline of our children. And by discipline, today it has become, just like Sarah was mentioning, mental health. It's one of those terms that have become negative to most people. When they hear discipline, they think in terms of a spank. I'm not talking about that. But as parents, we must come back to the place where we are the authority in the lives of our children from the foundational age. Because if they can't listen to you at 2, guess what will happen when they are teenagers? It's going to be tougher. So we must, and there are all kinds of resources, I cannot bring them all out at this point, that generally are talking about parenting, child training, and child discipline, which we can share with you. Those are the type of things we share when we meet in our conferences and seminars. We don't strictly talk about only mathematics and languages, but we talk in generality about family discipleship or family training, or how do you run a family? How do you parent children from the various ages to the different stages of their lives? And discipline is very much critical. If you are to, a child is to listen to you, if they are to pay attention in the class, if they are, when it's class time. But there are also other things you can do to help to make sure that they can learn. But there are studies out there that have shown education is best on one-on-one. Number two, education is best where there is that bond, that mutual love between the person of the teacher and the person of the learner. And nothing beats that a relationship of a parent and the child. Nobody loves your child or loves you better than your parent. So where there is already that nurture God has given us, it would be very good if we build upon the same, to ensure that we build on that, to make sure that education becomes possible. I mean, other parents have done it, you can do it. So in others, the questions are there, yes, if it's not something you've done, but it's something you can build upon. Do you teach them in different rooms or something like that? Again, like I said, don't bring school at home. Let this remain a home. You can teach anywhere, on the dining table, on their beds, as you're walking in the field, when you're taking care of the chickens, you can sit at the veranda, you can sit under a tree, you can be anywhere and teaching takes place. My home, we do not have a special room. We just have a living room. We have this big dining table. It is everything. We have shelves more than anything in the living room where we pile the books and the different scholastic materials. And that's how it is. Our kitchen, we built it in such a way that there is no wall between the kitchen and then the living room, meaning even when mommy is in the kitchen, she's looking on the other side, seeing what the children are doing some supervision and stuff like that. So it's basically, it's basic. You can do it anywhere in whichever way. There is nothing that says that unless the child is seated on a particular plastic type of chair, that's when they can learn. Not necessarily. You can do it anywhere. Teachers or specialists, I usually say that nature grants it to parents to be teachers. Even if it's chickens, you look at the hen in your villages, every hen, the moment it hatches its chicks, it begins to teach them how they can get worms and fend for themselves, basically. So the fact that someone is a parent, they are a teacher. Now, where there is that, we can do a lot to motivate those people. They can learn a lot which they can do to improve what they are doing, but it is already in there. In others, it does not necessarily take a specialized teacher who has degree, 4-year degree to teach or to enable, like I said, to teach someone how to learn. There, I don't mean that we don't need teachers, trained teachers, but life is like, not all of us are supposed to have degrees in economics to be economists. I may not be the economist like an expert in the field, but every day I'm dealing with economics in my house. I buy internet, I buy grocery, I make a budget for my home and all those type of things. That's economics. Now, I don't have to be an expert, but in the event that I need an expert, all I need is how do I find an expert? Where do I find resources experts have put in place? We just found resources today from doctors from 2 categories, a medical doctor and someone who deals in mental health. But that doesn't mean all of us now, let's go sign up for a degree in mental health. But we can access these resources. The same thing I believe our teachers need to get to a place where they are available as consultants in our communities, consultants to be available to put out resources online, which we can get from, or to be consulted in our homes, in our communities, small gatherings, which we can afford to do. When we meet together as homeschoolers every 3 months, we get these trained teachers and they share with us resources that parents can go and improve upon their craft. So it's possible even without someone being specialized. Concentration, I talked about that. Someone talked about what can we do to make sure our children are not left behind. So what happens, depending on where you are and what your goals are with the teaching and the learning of your children. But for most people, let me talk about from the perspective of, say, Uganda. Every country has an education system and has some laws in place and has curricula in place. In Uganda, we have a curriculum, and this curriculum is developed by National Curriculum Development Center. Now, National Curriculum Development Center does not develop textbooks like this. What they develop is what you would call a scope and sequence. And the scope, in their scope and sequence, for let's say this is book 7, primary science, what you find there will be this outline, that you teach this topic in this class, and maybe they give a breakdown of some basic detail, but they don't put the meat together. Textbooks like these are developed by private people, private players. In Uganda, we have various companies. I won't mention them. There are like 4 companies that publish books that are used in our primary school. So what we are doing, we are coming into that same space, developing textbooks, but the difference we are putting in for us is to make sure they are written in such a way that the child can teach themselves, or a parent can guide the child to learn. But the scope and the sequence we are building upon is the same scope and sequence given by the National Curriculum Development Center. So you're asking, how do I make sure that the children who are homeschooled are not left behind? You have the checklist, so to speak, where you are able to tick off and say, my son is done with this, so he's ready to move on to the next level, and you move on. So if you want them to sit exams, let's say these continuous assessment in any school, you can find a private school where you can ask them maybe to share with you the examinations they give to their children, or they are even available on the streets. Let's say the UNEB exams, those books are available on the streets or in the bookstores around town, where they compile all the past papers that have been done for the past 10 or so years. They are compiled. You can buy that, and as you teach your child, you keep checking, administering them to him or to her to make sure they are up to the level where you want them to be. In other words, it's possible to assess and to ensure they are not left behind. I think I've gone through some of the questions I got. Training of parents, I've talked about the seminars we do. That's the purpose, to train parents, but there are all kinds of resources online again. There's a lot of literature that has been written in terms of textbooks. There is research available. We have a WhatsApp group. If you are on that WhatsApp group, we keep sharing resources with one another. If you want to research on homeschooling, scientific studies that have been done, they are very much available.
Thank you very much, Mr. Chazi. Indeed, you have given us a lot, and we believe change will be done. So I'm going to welcome the International Commissioner to give a vote of thanks. However, allow me to recognize our National Treasurer. Thank you for joining us. All our board members, the young leaders, the YES participants, we are really grateful, and other people out there who have joined us who are not Girl Guides. So at this very moment,
Monica, the chairperson, please recognize the presence of the chairperson.
I'm really sorry. Maybe I skipped the name when I was looking through. Our chairperson, we recognize you. I won't say much because I may end up giving the vote of thanks. Oh, okay. The IC has just said that she's traveling, so maybe it may be hard for her. So then allow me welcome or ask our chairperson to give a vote of thanks to all our panelists and everyone. Thank you very much. You're welcome, our chairperson.
Thank you so much, Monica. I actually appreciate, and I didn't know that this meeting was going to take place. Is it a meeting? Is it a workshop? I don't know, but it has been very interesting. So when someone told me, I requested for the link, and she shared with me. But for sure, I'm so grateful to the facilitators. I entered a bit late because I remember I found the one who was talking about, is it well-being? Something like that. Doctor, I think. He was almost finalizing, but I was able to get Sarah full swing. And I appreciate you all, facilitators. Mr. Chaze, thank you so much to have touched on education, to have touched on this challenge that is facing us. But still, as I always tell the girl guides, some of the misfortunes come with their fortunes as long as we are ready to pick. You have seen how people are embracing technology very fast, how our children are coming on board, the parents able to monitor them. It is very important, and I think that is the way to go, whether we like it or not. So if we continue receiving such talks, it is going to give us a very big mileage. And for the participants, thank you so much. We started as a big number. Now I see it is reducing, but still, I know everyone must have picked a leaf here and there. Mr. Chazi has said that they have resources that they can share, especially on WhatsApp. We shall appreciate that, because as parents, this is exactly what we need. We need to be encouraged to pick the technology. We need to be encouraged. And above all, we shouldn't lose hope, because I know God will see us through. So thank you so much once again, and I wish you all the best. Thank you.
Thank you very much, our chairperson. I won't add on much because she has really sent our appreciation. I will also recognize Chihembo Rita. Thank you for always being behind our Zoom rooms, hosting us and always operating. Madam Kathy, we thank you. Please, let's take note that this is a series. It is a COVID series. It is going to be happening every Wednesday. And today has been our number one, like our first day. So please always remember to log in on Wednesday. We shall be sharing links always and advertising. So note it down that every Wednesday I have something to attend to. Otherwise, I want to thank everyone. Do we have any comments, anything left out before maybe we log out?
Yes, Monica. One last thing. Yes, one last thing. I'd like to invite you all for. Hi.
Patience, please go ahead. We can hear.
I was saying I'd like to invite you all for our World Summit that's happening tomorrow. It's organized by the Yes Girls, and we'll be sharing what we as the Yes Girls have done to help girls or to look out for girls during this COVID time. Yeah, and also learning a few more things on mental health and surviving throughout the entire lockdown. It will be posted on all our social media handles. That's Yes Girls Movement on Facebook, Twitter, Instagram. Yeah, please go like, subscribe, follow us. Yeah.
Patience, let me add something on that, on the invitation. This one, the summit for tomorrow, is organized by all the 13 countries, the COVID teams from all the 13 countries. So please be there.
Hello.
Yes,
Hello,
please.
Monica.
Yes, please go ahead.
Yes, okay, thank you, Monica. Yes, I would love to inform and encourage other young leaders who are on this call to sign up on the U-Report. It's a collective thing, so I would request for your collective effort and support towards it. I believe we can make it. It is just very easy. It takes like 1 minute for you to sign up on the U-Report. Basically, maybe Monica, you could, should I continue, or you can tell them just a bit background about it?
Lydia, go ahead. Maybe we have lost her. So with the U-Report, it is a platform where we can be sharing our views. And so we call upon all people out there to come and sign up. It's simply, you just use a link on Messenger or WhatsApp. We have been sharing it on our social media handles. And when it asks for the code, please you log in UGA in capital letters, UGA. And by that, you will have successfully registered for U-Report. The UGA stands for Uganda, so it shows that you've joined and you've been mobilized by the Uganda Girl Guides Association, yes, participants. So I think by that we can log out, continuously. Thank you. And to tell you that stay tuned, we shall be sharing more and more activities as the yes participants. Thank you very much. We have finalized. We can start leaving, or maybe can we take a peek? We can turn on our videos and then
let's turn on our videos.
Yes, let's turn on our videos. Rita, kindly please help us take this photo.
Okay, I'll do that shortly.
Okay.
Madam Kathy, why are you laughing?
So I saw Priscilla, she comes in and goes away. Somebody, I think, Patience's sister.
She also wants to be in the picture.
She's a girl guide.
There you go.
I'm done.
Thank you, Rita.
Okay, thank you, Rita. See you, people.
Thank you, everyone, and thank you for listening.
See you.
Have a good day.
All right.
Good day too. Bye-bye.